At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How to Address Stress, Anxiety, and Depression with Diet on Wednesday, June 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, Dr. Tom Roselle here. Welcome to Dr. Tom Roselle Live, and we got another interesting platform to go through. I'm really sorry we've had such garbage weather out there. It's been kind of cold and ugly. At least we had one good Memorial Day, sunshine day. It was nice. We were out on the deck with family and just kind of hanging out, and it was a good time. It was really nice. Not too hot, not too cold. Skies were clear, and I said, well, we got shined upon today, so hopefully we'll get some more of it. And this nonsense is over. This is like living in in Washington State, where it's always raining. I don't know how people can live up there. It makes me crazy. Hey, let's talk. Let's get into a little bit of what happens to your body immunologically, if you will, when you've had COVID-19 shots. And we're going to take it from a neurological platform. But before I do that, I want to invite you to join Dr. Stephanie Pina and Annabeth Goss, who is one of our top nutritionists at the Roselle Center. And on the coming up on the 18th of June, a couple weeks down the road, and 6 p.m. at the Roselle Center for Healing. What they're going to talk about is something that I think everybody needs to be aware of, and it's just how to address your stress and anxiety and your depression with dietary modifications and acupuncture. Now, we all know that biochemically, a lot of us go into the highs and lows that we shouldn't go into because we don't eat the way we're supposed to. We're grabbing candy bars and potato chips and, fast-acting foods. And we talked about the amount of sugar that goes in your system. Well, a lot of you said, okay, great, you sold me, but what do we do about it? Well, that's what they're going to do on the 18th at 6 p.m. at the Roselle Center for Healing in Fairfax. Join Annabeth and join Stephanie Pina, Dr. Stephanie Pina, and they're going to tag team, and they're really going to put it together. I'm just going to kind of be hanging out in the background, not saying too much about anything, and because I'm going to learn from them as well. So join us. Give the office a call, 703-698-7117, and register. Alternatively and easily, just go to rosellecare.com. You scroll down, you see the ad for it, click it, and it'll take you right in. The only thing that we ever ask you for any of these programs is if you register and you can't make it, something comes up, but life happens sometimes, is give us a call, because we try to do these as a gift for you, but we want to make sure that we can adequately support the people that do show, and we have places for them to sit and so forth. So join us on the 18th. Coming up within about 3 weeks at the Roselle Center in Fairfax. So join us there. Let's get into the program. I want to talk a little bit about COVID vaccines and neurodegenerative diseases. And you can say, neurodegenerative diseases, what does that have to do? Well, that has to do with your nervous system. See, I'm the guy that spent, almost 5 decades looking at people that have neurodegenerative problems on every level, and it has to do with how that nervous system handles your immune system, how that nervous system handles your muscular system, how that nervous system handles hormones and brain function and so forth. So when we talk about neurodegenerative diseases, we're talking about what happens in this particular situation with COVID vaccines. So, there was a senior researcher, and many of you may have read a short article that was written by her on Joe Mercola's site. And Stephanie Seneff, she's a senior researcher scientist at the Massachusetts Institute of Technology, MIT, and she was talking about the risks of COVID vaccines and their direct link, heavy finger pointing to neurodegenerative diseases and what's called VAIDS, VAIDS, or vaccine acquired immunodeficiency syndrome. And that's a real deal, by the way. So don't set it aside, oh, it's nothing. No, vaccine acquired immunological suppression is very significant. We've been talking about it ongoing. I'm one of these guys that put my head on the line, during the middle of COVID. You have to understand what the potential risks are before you say yes to any of the nonsense. Fortunately, now with Bob Kennedy, he's stepping up and say, "Hey, listen." So what they did? They're saying, "Well, anybody that's under the age 65 or under, unless they're really at risk, that we're not going to recommend that they have the COVID vaccines." So how did they come up with the arbitrary 65? Number one, I'm above that, and I'm in great health. And there's nobody that's going to put that in my body because I know what is taking place and how these artificially produced mRNA vaccines go in and suppress your natural immunological reactions. But let's talk about when these neurodegenerative diseases. We're going to talk about everything from Parkinson's disease. We're talking about neurodegenerative brain problems, Alzheimer's conditions, ALS, Lou Gehrig's, and it continues to move forward, right? And patients come in and say, "I just hurt everywhere." Well, we've learned lessons, from the onset, if you will, of some of these things that we just mentioned, and that they were triggered from the spike protein of COVID-19 shots, not the disease, but the shots. Although the disease itself did have part, but we're talking about the vaccine at this point, and they're leading to a problem where you're seeing these deposits in people's brains, and in cases like Parkinson's, it's called Lewy bodies, and then the amyloid deposits, and other conditions, and not okay. So when we're looking at genetic altering modifications that these COVID-19 shots may induce, and it's a release of something called exosomes into the circulatory pattern. These exosomes can contain the mRNA along with the spike protein. So you have the catch-22. You're using something to modify something, but it's actually enhancing it or making it more susceptible or worse. And that's the piece that I want you to remember. It can make things worse. So if that's the case, and there's articles being published all the time, why is it that we are having these things set aside? We know that there are all kinds of things out there that will cause cancers. You've heard me talk about Roundup, the glyphosate, and they're huge in the United States and in Canada, and it seems to be the more Western countries. And we know that these things are extremely well correlated, if you will, with all types of cancers, particularly breast cancers, by the way, ladies, sorry, pancreatic cancers. That's one of the reasons that we're seeing such a rise on it. And you're hearing all these commercials right now about, don't take the glyphosates away from big agriculture because it's going to increase the cost of food. Well, no, not really. There's other ways of doing it. It actually, what this stuff does, it actually knocks out your local farmer. So when we know that this may be a problem, and there's very specific finger pointing, then we got to look at the rest of the story, right? So here's the problem. Here's the problem with things like that, but also the COVID-19 shots. They teach your cells to produce a specific protein, and that protein triggers an immunological response, and including the production of certain types of antibodies. Now, the problem is that because natural mRNA is broken down into experimental gene therapies that are used to deliver uh, specific things to the cell, this is not okay because the shots, the mRNA, use these small little guys called nanoparticles, and they contain something called PEG, PEG. What's that stand for? It's polyethylene glycol. And the mRNA is wrapped in this outer nanoparticle. It's actually called a lipid nanoparticle, and it carries these polyethylene glycols directly into the cell. And the problem is that it's supposed to increase its stability, but it doesn't. Now, if you were to inject an RNA, ribonucleic acid, into your body, enzymes would immediately, if you would, break it apart. They would knock it to shreds. But the COVID-19 shots are specifically designed so that doesn't happen. Instead, this RNA doesn't break down, and it efficiently begins to produce a protein. You remember the spike protein? So they're basically redesigning the mRNA and to make it look like a human RNA. So this is a laboratory thing. They're reinventing it, but the cell doesn't realize it's been invaded by an artificial something because it looks like a human molecule. So they've done all these things, to make sure that it's solid, it's sturdy, it doesn't break down, it doesn't degrade, and it keeps producing and making that spike protein. So it doesn't go away. It persists, and it gets into the lymph nodes where it likes to hide. It gets into the spleen. It gets into a lot of soft tissue. And these people who have had these COVID-19 shots, at least 60 days later, minimally, they're showing all kinds of really shocking abnormalities. And we've been saying that for a long time. And actually, a couple of years ago, I got myself into a little bit of a problem talking about how it's affecting the heart the same way, causing the pericarditis and the myocardial patterns. This is an inflammatory cascade as it was a result of the mRNA vaccine. So the spike protein that is naturally found in SARS-CoV-2 and is also being produced in your body when you receive the COVID-19 shot. So now we're getting into the long COVID pattern, right? It's responsible for the pathologies of all kinds of viral infections and increasing your risk of your body being susceptible. And we've talked about the studies, one came out of Saudi Arabia and so forth, that people who had vaccines were much more susceptible to other viral damage and irritation and actually the perpetuation of underlying triggers. And that's where you got the Bell's palsies, and that's where you got the herpes simplex, and that's, all of those things. Now, if you will, distribution, which means, how they got it out, and this came from Pfizer, was used to determine where the injected substances ended up in the body. So that's a biodistribution. Where does it go? So it showed COVID and spike protein from the shots accumulated quite high concentrations. Guess where, ladies? Unfortunately, in the ovaries. So what we're seeing is the inability of women to be able to get pregnant or miscarrying if they do get pregnant. And the vaccine particles move from the injection site to the blood, circulating these spike proteins, and they're free to travel throughout the entire body, including the ovaries, the liver, neurological issues that we're talking about right now. And we're going to get into that now and what really, really take place. So these spike proteins from the COVID-19 shots could be leading to a disease-like process that gets into the nervous system. And what they're finding is the increased levels of these, like in Parkinson's, these Lewy bodies is what they're called, and amyloid deposits in people who have Alzheimer's, and these irritations within the covering of the cord in people who have MS, multiple sclerosis. But also what they're finding is it gets into the joints and increasing the, if you will, the symptomological process of arthritic conditions from an immunological situation, like what? Like rheumatoid arthritis. So if that's the case, and they know this, why are they continue to say, take this, when they know it doesn't work anyway? So when you have these very specific finger pointings that are coming directly from, if nothing more than the accumulation of evidence from these vaccines, we have already shown that the mRNA vaccine ends up in high concentrations in these different areas. We know that exists. Why are we risking that? And by the way, in other parts of the world, they're not doing it anymore. They're not risking. They're not saying, no, we're done, one and done, not happening anymore. But here in good old US of A, we're still pushing them. Does it have to do something with money? I don't know. The research has shown that these vaccines, in contrast with something called a recombinant protein vaccine, that's where you put a little piece of the original disease into the body, are showing very significant problems. So why are we even looking? Do you realize that what they're doing now with these vaccines, this mRNA vaccine that they originally came out for the COVID, they're putting it into other forms of vaccines as well. And then this list of vaccinations is going exponentially through the ceiling. I think the count right now is 72, 73 from the time of birth all the way through. Kid doesn't leave the hospital without like almost a dozen, 6 anyway. Doesn't make sense. I don't know about you, but this old boy that's been around, in practice and seeing patients for almost 5 decades has got some questions. And I'm the guy that's digging. And I'm not telling you to believe me. I'm telling you, do your homework. Start looking at why these shots may induce immune cells to release large quantities of these exosomes into circulation. And these exosomes are extracellular, and they contain the protein of DNA and RNA and other things that are in it. And it's altering your expression of your own body's immunological process. It's suppressing your immune system. It's causing other things to show up that shouldn't have been there to begin with. And unfortunately, people are dying because of it. And they're burying the numbers of people that have really died because of this. So, in my opinion, there's some guys out there that push this that probably have committed genocide. That's me talking. And, maybe they need to have happened to them what we did to some of the people who committed genocide in World War II. I don't know. I'm just thinking out loud. But, the people who've received the COVID-19 shots, could shed vaccine particles to those around them. It's called shedding. It's a real deal. It's a real deal. We test people and we find out, and we have ways of doing it through neuromuscle function response testing. And I'll say, would you expose to such and such? I said, no, I didn't. I said, how about your husband or how about your wife? Yeah, they got it. Well, guess what? Ask them if they got this vaccine. And they come in the next time and said, yeah, they had it. Well, I said, that's called shedding. You got it too. It really happens. It's not something that is make-believe. It's really there. So how could these COVID-19 shots be significant in shedding? It's a possible process. It's one that if you think about it just on, common sense terms, that if somebody that was close to you got it and you swapped fluids, you even kissed them, or they coughed on you, or they spit on you, or they sneezed on you because it's your husband, your wife, or your children, you were exposed to the COVID-19 vaccine. Now, these exosomes that we talked about a little while ago can travel to distant places. It's possible, and if not impossible, they're being released from your lungs and inhaled by a nearby person. The extracellular vessels, including the exosomes, have been detected in spit and mucus and epithelial fluid, when they do a swab, right? They know it's there. But so why did they hide it? Because the lawsuits that can come about because of it, which are just starting, by the way, finally, in my opinion, can be quite significant. So further evidence is mounting. And these vaccine-acquired immune deficiency syndrome problems that are showing up in everybody's offices, and most docs, unfortunately, don't know what they're dealing with because they haven't been told what to deal with it, because the standard of care is written by the drug companies for the most part. But without type 1 interferon response, and that's the natural production of antiviral elements in your cells, type 1 interferon response. Vitamin C triggers that, by the way. Keep your vitamin C levels up. Echinacea, keep it up. That triggers your interferon response. It's also anti-carcinogenic. The T cells don't build up the way they should following an infection or response to some type of triggering mechanism of cancer. So as you can see, this is something that is significant, and it's not going away in the foreseeable future. It's something that you have to make sure that you understand that it's a possibility, and then what can you do about it? Well, you want to make sure you load your body up just nutritionally with things like sulfur-laden foods, garlic. God bless my grandmother. I was treated with that ongoing as a child. Onions, the different type of cruciferous vegetables, organic, free-range grass-fed eggs, grass-fed beef, fruits and vegetables. Those are the things that you have to make sure you put in your body. Make sure your vitamin D level is extremely high. I recommend minimally 10, 15,000 a day. And yeah, you get up, they don't want you up over 100. Well, the functional medicine normal on blood tests goes up to 150. So I wouldn't be too concerned. The evidence is there to support that as well. So you have to make sure that you have everything that you can possibly have around you. St. John's wort, which is hypericum, vitamin C, glutathione, all those things help. But when these guys get into your nervous system, they cause neurological degenerative diseases. We're seeing a ton of it in our practice on an ongoing basis. We're seeing so much of it that I'm getting worried about humanity, but we're able to at least help on a lot of different levels using a lot of natural platforms. So I want you to understand that you have to do your research on an ongoing basis. Don't neglect it. We're coming up to the end of the program, and I want you to follow me on Dr. Tom Roselle Live and follow me on all social media sites so you know immediately when we click in. We're going to continue this conversation. I'm going to give you a little bit more data, a little bit more information, and things that you need to do. And by the way, coming up at the office on the 18th, a couple of weeks from now, Annabeth Goss and Stephanie Pina are going to talk to you about your diet. Anyway, we're almost there, and don't forget to join me. Remember, I'm here every Sunday, and for one reason only. You deserve the information. I love you all. Have a great day. We'll see you next week. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How to Address Stress, Anxiety, and Depression with Diet on Wednesday, June 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.